Hey everyone, it's Dr. Denise from VIVOS Wellness, and I would like to welcome you to a little bit of an educational series that we're doing here. And we're going to start with the skinny on medical weight loss. Medical weight loss has kind of been really big lately because of all of the medications and things like that that have come out. And so I thought it would be a good topic for us to start with. So a little bit about me is I am a board certified OBGYN. I've been practicing for nearly 2 decades. I'm the founder of VIVOS Wellness. We opened this place in 2023. And I have a little bit of an expertise in intimate wellness and pelvic floor therapy as I'm an OBGYN. And I am and have always been passionate about health and wellness. And I'm also a member of the Obesity Medicine Association. So I'm here to help you promote wellness, which, includes managing being overweight and obese, because there are a lot of things that can go along with having those conditions. Now, why does this matter? Well, the U.S. adult obesity rate increased to 41, almost 42% from 2017 to March of 2020, and that's up from 30.5% from 1999 to 2000. During this time, the prevalence of severe obesity increased to almost 5% it increased from almost 5% to 9%, so it nearly doubled. And of that, the breakdown is 19% of that were young people aged 2 to 19, 40% were aged 20 to 39, 44% were about 40 to 59, and 41.5% were older than 60. So what are some of the repercussions of obesity and being overweight? Well, heart disease is one of them. It's a major risk factor for coronary artery disease, heart attack, and stroke. Type 2 diabetes, because excess body fat can lead to insulin resistance and diabetes. Hypertension, this increases your risk for cardiovascular disease as well as renal failure and other complications as well. Cancer, it actually increases your risk for lots of different types of cancer, including stomach cancer, colon, prostate, breast, ovarian, endometrial, and cervical, among others. It can also cause joint problems. Excess weight generally can cause problems in the hips and the knees, and can lead to severe osteoarthritis. Sleep apnea, this is a big one. You'll have difficulty breathing at night because of the increased adipose tissue and thickness of the neck, so it kind of blocks off your air supply a little bit at night, and this can also lead to sudden cardiac death. Liver disease, non-alcoholic fatty liver disease is really common in people with obesity, and that can lead to more severe liver complications. Psychiatric disorders, being overweight and obese can increase your risk for anxiety, depression, low self-esteem, can lead to much worsening of those illnesses. And there's always an increased risk of premature death when you have obesity. Now, for women, there's also a set of problems that goes along with it. You have an increased rate of early puberty, heavy or irregular periods. This is incredibly common in the obese population. It can lead to infertility, pregnancy complications, early menopause, and your symptoms when you go through menopause could be worse than they would be otherwise. And pelvic floor disorders, when you have increased weight, you have increased risk for leaking urine, especially stress incontinence, when you cough, sneeze, or jump, but also increased risk for a cystocele, your bladder kind of coming down, or a rectocele, the rectum coming out, or even uterine prolapse where the uterus can come down as well. Now for men, you can have hypoandrogenemia. That means your testosterone is low, but you can also have elevated estrogen, which kind of throws everything off. This can lead to erectile dysfunction, decreased sperm count, and infertility. Benign prostatic hypertrophy, or BPH, is really common in this group. Stress incontinence, believe it or not. And this one is really serious. You could have a buried or hidden penis, basically because of all of the excess fat in the pannus that it sort of hides everything. This can then, of course, lead to some psychological barriers to intimacy. Now, what are some of the challenges that people face when they're trying to lose weight? Well, one of the big ones is lack of knowledge. You don't know how to read food labels. You don't know what's good for you. You don't know what isn't good for you. It's hard to kind of discern all of that. You can have genetics that can cause a problem. Hormone changes. You may have issues with social support. You want to lose weight, but your family either doesn't want to or doesn't need to and isn't very supportive of it. Different lifestyle factors, how many hours you work in a day, are you working nights, are you working days, if you have medical conditions. The other thing that can happen is if you do get on the weight loss journey, you can reach some plateaus or have slow progress, which can lead to frustration and then just giving up. You can have unrealistic expectations where people just expect the weight to just come off super fast. Well, it didn't go on super fast, so it's not going to come off super fast. Decrease in motivation. People have cravings for different foods or different food addictions. Unhealthy eating habits, eating late at night, or eating fast food all the time, and then some other social and environmental factors. This can lead to emotional eating. When we're happy, we eat. When we're sad, we eat. And sometimes we do it in secret. We kind of sneak out and go into the refrigerator at night and kind of get some stuff so that people don't really know what we're doing. And these foods that are high in sugar or fat are high reward because they release these happy chemicals from the brain that make you feel good when you have them. So it becomes an addiction almost, where you just kind of crave that all the time. And every stage in life, every single stage in life has a risk for weight gain. We're talking about puberty. We're talking about early adulthood, like college. We're talking about preconception, pregnancy, postpartum, menopause, perimenopause. Those are all risk factors for triggers that can lead to weight loss. And they all can lead to this sort of desire for these hyperpalatable foods. Now, it's not all willpower when it comes to that. Like I said, these foods release a chemical in your brain that make you happy. They make you feel good when you have them, and so you seek out that feeling again. So it's an actual hormone or peptide that is responsible for these cravings and these happy feelings. And on a lot of people with obesity, they can't overcome this sort of craving. And then that can lead to just going after higher reward foods. Now, there are some breakthroughs in medications that can help. There are some stimulants like phentermine. There's some over-the-counter appetite suppressants like fiber, green tea, apple cider vinegar. There's also Ally, who doesn't allow you to absorb certain nutrients like fats, but that has a lot of GI side effects. Now, some of the newer ones, this is the one that everybody's talking about, right? The GLP-1 medications, the glucagon-like peptide medications. Semaglutide is one that most people know of as Ozempic. It reduces blood sugar, and it reduces the cravings and slows down your digestion, so it makes you feel full for longer. Now, there's a newer one, tirzepatide, which is both a GLP-1 and a GIP, which is a glucose-dependent insulinotropic peptide receptor agonist, which in most cases actually is counteractive to the cravings and all that other stuff, but somehow with the GLP-1 activity, it improves your ability to kind of bypass those cravings. Now, that other receptor may desensitize those craving receptors that you might get. This is better for people who have insulin resistance, and the studies have shown that it can be somewhat better tolerated than semaglutide. Now, there are some side effects. Everybody needs to know about the side effects. I'm not going to go into that big, huge, long list that everybody hears on TV that you're wondering, like, why would anybody ever take this medication? But some of the major side effects that most people or a lot of people experience are usually GI side effects. That's bloating, you can have nausea, you can have vomiting, diarrhea, or constipation. You can have headache, fatigue, dizziness, and some people have worsening depression. So these can be some side effects that would cause people to either shy away from the medications or stop taking them altogether if they're having issues with it. Now, if you are ready, right? You're ready to make a change. If you're ready to make a change, that means you're motivated to move forward with things. You're motivated to start walking more, taking 5,000 to 10,000 steps a day, drinking more water, tracking your food, because that is actually one of the most reliable things that you can do for weight loss that has been shown for well over 50 years, that is one of the best things that you can do that is most consistent for reliable and long-term weight loss. You can commit to following a specific diet, staying within the calories that are provided for you. And how does all of this start? Well, there's an initial history and physical. And I'm going to need some blood work. I'm going to need to know whether or not you're a good candidate for these medications, because if you're not, I can't give it to you. It's not safe. But we can still do other forms of medically supervised weight loss. If you are a candidate, you would start your weekly injections. And you would also take probiotics, increase your fiber, make sure you're drinking 3 to 4 liters of water a day, take stool softeners as needed, and these will help to mitigate some of the side effects. And you have to realize that the medication isn't a magic bullet. It's not going to do all the work for you. You still need to adjust your eating habits and make sure you're eating the right foods, not just eating less of the bad foods. Now, if you are ready, again, and motivated to change, like I said, you would increase your activity, right? 5 to 10,000 steps a day. That's the first step. Then you'll also increase your exercise, maybe 75 to 150 minutes of more intense exercise, or anywhere from 150 to 300 minutes a week of more moderate intensity exercise. You want to keep a diary of not only your food, but your habits, so that you can identify certain areas where maybe you can make some improvements. And you can make simple changes. That's one of the first things you can do. You'll take the stairs instead of the elevator, park just a little bit further away so you get a little bit more steps in during the day. Now, we have several different tiers of our weight loss programs. We have 2 different ones. We have one for semaglutide and one for tirzepatide. Now, the tiers are basically the same for both, but the price point for the medications is different. So the semaglutide does have an indication for people who have diabetes and have some other comorbidity, hypertension, or cardiac disease, something like that, because it does provide some cardioprotection in patients with diabetes. Now, like I said, we do have programs for several different levels for our weight loss, and we have all kinds of different budgets, right? We can meet different budgets for you. If you're thinking, I don't need much, I just need a little bit, just a little push, maybe 5 to 10 pounds, and you just want to start the medications and see if it works for you, okay, we can do that. That is a medication-only program, and you will see me once a month so I can check your side effects, make sure you're doing okay, but otherwise you'll have no other support or guidance. You'll just get your medications each month, and then you'll come in once a month to review. Now, we have a Slim Fit program, which is our middle-of-the-road program. This is more supervised. You would get your medications, your semaglutide, plus you'll have your first month of meal replacements included, and that is about $128 value. You'll have your first month of Slenderize injections, which is our metabolism booster vitamin cocktail, and that's included, and that is a $400 value. You will also have 2 radiofrequency ultrasound body treatments. That's a $2,000 value that's included. And you'll have a diet You'll get weekly protocols that will address different habits like nutrition, behavior, and exercise. So it can help you to kind of guide your progress, help you realize why you eat when you eat. Do you do mindless eating? Do you eat when you're doing activities, you're doing other things? So there's a lot of different things that go along with those protocols that can help you to kind of move your progress forward. Then we have the Optimum Body program, and that includes all of the medications, but this one includes all of your meal replacements for all 12 weeks. So all of those meal replacements for all 12 weeks, that's about a $384 value. It also includes your weekly Slenderize injections. You'll get it every single week. It includes all of those. That's $1,200 value right there. And you'll have 4 radio frequency ultrasound body treatments. That's up to $2,000 value. So that's a really good value that we have for that highest level of our program. And most likely the highest level, most people are going to have the most success. Now we have the same tiers for the tirzepatide. The price point is slightly different because the tirzepatide is a more expensive medication, but studies have shown that it is better tolerated than semaglutide, and it's better for people who have insulin resistance. So those people who have maybe PCOS or have irregular periods, they have increased hair on their face and things like that that they don't want. Now, what's really important, I've mentioned these meal replacements, right? Meal replacements are essential to the diet that we're giving you because they provide a complete nutritional profile for a meal for you, protein, fat, and carbs. And they will keep you full. They're going to keep you full. They're going to keep you satisfied. And studies have shown like that people who have meal replacements with their diet have more weight loss than people who just had diet alone or diet and support. And this weight loss continued or maintained even at 1 and 2 years after starting the program. So meal replacements are really important, and we do have some great meal replacements here, a combination of a shake or a pudding and some bars, and they really do satisfy you for an entire meal. Now, this can have life-changing results, right? Absolutely life-changing results. I'm sure a lot of these people you recognize here. Oprah, most of us know that Oprah has had a long-standing issue with her weight. And she said the fact that there's a medically approved prescription for managing weight and staying healthier was like redemption. It was like she could finally have something that could help her maintain her weight and not feel ridiculed for it. Even Rebel Wilson, who had a significant weight loss, she did use semaglutide for some of that weight loss. And Tori Spelling, that tiny little 90210 star, after her 5th child, she noticed that she was having some trouble getting the weight off. And so she was able to lose the weight and get back to her normal pre-pregnancy weight using Mounjaro or tirzepatide. And then we have also a Roe ambassador who talks about how she doesn't even think about eating between meals, and she doesn't have the cravings that she used to have, including alcohol. So it can really be life-changing for a lot of people, especially when you realize you just don't have those cravings anymore. If you're a sugar addict and you can look at cookies on a plate and think, I don't really want that. That's a huge change from somebody who sees it and knows how good it tastes and their mouth starts watering and they just need it. This will help take that craving away. Now, Terry Dubrow, the plastic surgeon, says basically that he feels like semaglutide's like the new Botox. He just loves it. Now, if you have any further questions, you want to get some more information about our weight loss programs, you can always contact us at VIVOS Wellness. We are here in Kissimmee, Florida, and we'd be happy to see you and talk to you about it and counsel you. at any time. So if you have any other ideas for maybe some educational topics that you'd like me to address, just let us know, and we'll take care of that for you. Thanks for watching.